Welcome everyone to the Surgical Master Monthly Coaching Show. The first case we're going to discuss in this coaching show is a follow-up case of insufficient bone where we have planning a 4-unit anterior bridge using implants. Should you do implants here? Should you not do implants? How do you think through the bone? Next, we have a lower molar case on a patient with mega bruxism, juvenile disaster. We have a 16-year-old boy that has a disaster of what looks like first molars. We've got my first socket grafting case. The doctor executed it with mastery. Look at that suturing. We're gonna review the case. Soft tissue correction on tooth number 9. Should you correct? Should you not correct? How do you manage this case? Is there restorative dentistry happening? Why is it an issue, tooth number 9? There's other issues in the mouth. Next, we have an implant-supported denture. Who of us does not have patients that need all their teeth removed and need dentures? Next, we have implant failure. If you're gonna place implants, you're gonna have failures. Next, we have a recession case, very high lip line. Then we have an implant placement is the easiest part of this case, but the rest of it, okay? Let's discuss what's challenging you, doctor, with regards to this case. Implants with vertical bone graft. So we want to place implants. We're losing multiple lower anterior teeth. Who of us doctors does not have this case in their practice? Next, we have a sinus that's exposed. Ouch. After that, we're going to talk about congenitally missing laterals. Both my brother and my sister have congenitally missing laterals. Next, we have multiple implant placement. So we've got a bunch of missing lower molars here. Let's talk about how to structure this. Next, we have a mandibular molar with recession. When is recession a problem? Why does the recession look like that in this case? Should anything be done about it? Next, we have CTG question, connective tissue graft. Next, we're gonna have implant supported overdenture with failing implants. Next, we will have implant placement and the number 30 site. After that, we have 36, extraction and grafting. This is the money tooth, ladies and gentlemen, a classic example of the money tooth. Failed anterior implant with tissue and bone grafting necessary. It happens, they fail. Next, we will have large edentulous area. How do we manage that? Soft tissue deficiency at a missing number 12 or a lateral. Next, we have poor tissue quality for implant number 11, and good on you, doctor, to realize that. Next, we have soft tissue evaluation. Next, we have a graft, a canine with recession, and that canine looks a little funky. Next, we have soft tissue graft failure. Next, we have soft tissue grafting failure upper arch. Looks like there's an alloderm graft that was done there. It didn't work out too well. Let's review why it happened. And thank you for bringing this to the table. Connective tissue graft on number 14 to cover 3 millimeters of recession. And then we have some general questions on bone grafting.